Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your life. Today, let's talk about oily skin, and let's focus on one mineral that deserves a careful, balanced discussion: zinc. Look at oily skin as more than just shine on the forehead or nose. Oily skin means the sebaceous glands are producing a larger amount of sebum, the oily mixture that protects the skin barrier. Sebum is not the enemy. You need it. It helps reduce water loss, supports the skin surface, and plays a role in defense against microbes. But when sebum production becomes excessive, it can mix with dead skin cells, clog pores, make makeup slide off, create a greasy feeling, and contribute to blackheads, whiteheads, and inflammatory acne. So ask yourself, why would zinc matter here? Zinc is involved in immune regulation, wound healing, inflammation control, skin cell turnover, and the function of enzymes throughout the body. In dermatology, zinc has been studied mostly in acne, not just simple facial oiliness. That distinction matters. We should not pretend zinc is a guaranteed oil control treatment for everyone. But the connection is medically interesting because oily skin and acne often overlap, and zinc appears to influence several pathways involved in acne-prone, oil-prone skin. Start with the sebaceous gland. These glands respond strongly to hormones, especially androgens. That is why many people notice more oil during puberty, around menstrual changes, during stress, or with conditions such as polycystic ovary syndrome. Zinc may have a mild effect on enzymes involved in androgen signaling, including pathways related to 5-alpha reductase. Why does that matter? Because 5-alpha reductase helps convert testosterone into a more potent androgen called dihydrotestosterone, and androgens can push sebaceous glands to produce more sebum. Zinc is not the same as a prescription hormone treatment, and it should not be sold that way. But this possible pathway helps explain why zinc is often discussed for oily, acne-prone skin. Now look at inflammation. Oily skin by itself is not always inflamed, but when oil, dead skin cells, and bacteria collect inside a follicle, the immune system can react. That reaction gives you redness, tenderness, swelling, and pus-filled bumps. Zinc appears to help regulate inflammatory signals. Several reviews of acne studies have found that people with acne often have lower blood zinc levels compared with people without acne, and that zinc treatment can reduce inflammatory acne lesions in some patients. This does not mean every person with oily skin is zinc deficient. It means zinc status may be one piece of the bigger picture, especially when oily skin comes with inflammatory breakouts. Pay attention to the bacteria angle too. Cutibacterium acnes, the bacterium associated with acne, lives naturally on the skin. It is not simply an outside invader. In the right environment, especially inside clogged follicles, it can contribute to inflammation. Zinc has been shown to have antibacterial and anti-inflammatory activity in skin research. How could that help? By making the follicle environment less reactive and less inflamed. Again, do not hear this as zinc cures acne or zinc stops oil. Hear it as zinc may support a skin environment that is less prone to inflamed breakouts. There is also the barrier issue. Many people with oily skin over-cleanse. They scrub, use harsh toners, wash 5 times a day, and chase a tight, squeaky clean feeling. Then the barrier becomes irritated. What happens next? The skin may sting, flake, and still look oily. That combination is frustrating because the surface is irritated while the glands underneath continue producing sebum. Zinc is involved in repair and healing, so adequate zinc intake supports normal skin recovery. But do this correctly. Do not use zinc as an excuse to damage your skin barrier. Use gentle cleansing, avoid aggressive scrubbing, and let zinc play a supporting role rather than trying to force the skin into dryness. Now let's make this practical. First, look at your diet. Zinc is found in oysters, crab, beef, poultry, dairy products, beans, lentils, chickpeas, pumpkin seeds, nuts, and fortified cereals. Animal sources are often absorbed more easily because plant foods can contain phytates, which bind zinc and reduce absorption. If you eat a vegetarian or vegan diet, pay attention. You may need more planning to get enough zinc. Soaking beans, sprouting legumes, and using leavened whole grain breads can help improve mineral availability. Ask yourself, do I actually need a supplement? If your diet is limited, if you have chronic digestive disease, a history of bariatric surgery, heavy alcohol use, an eating disorder, or a very restrictive diet, zinc intake may be lower. In those situations, professional evaluation is wise. Do not guess for months. Ask your clinician whether testing or dietary review makes sense. For adults, the recommended daily intake is about 11 milligrams for men and 8 milligrams for women, with higher needs during pregnancy and breastfeeding. The adult upper limit is 40 milligrams per day from food and supplements combined. This number is important. More is not better. High-dose zinc taken for long periods can cause nausea, stomach pain, vomiting, a metallic taste, reduced copper levels, anemia, nerve problems, and changes in immune function. It can also lower HDL cholesterol in some settings. So do not stack a multivitamin, an immune supplement, a hair supplement, and a zinc tablet without counting the total. Look at the label carefully. Many products list elemental zinc. That is the amount that matters. Zinc gluconate, zinc citrate, zinc picolinate, and zinc sulfate are different forms, but the key question is, how many milligrams of elemental zinc are you getting? If you choose to try a supplement for oily, acne-prone skin, stay conservative unless your clinician tells you otherwise. A common approach is to use a modest dose, take it with food to reduce nausea, and reassess after 8 to 12 weeks. Skin changes take time. Do not judge it after 3 days. Also, separate zinc from certain medications. Zinc can bind some antibiotics, especially tetracyclines and quinolones, and reduce their absorption. It can also interfere with penicillamine. If you take thyroid medicine, iron, calcium, or other minerals, timing may matter too. Ask your pharmacist. Do this before starting, not after you have already bought 3 bottles. Pregnant or breastfeeding? Do not start high-dose zinc for oily skin on your own. Your prenatal vitamin may already contain zinc. Too little is a problem, but too much can also be harmful. If you are trying to become pregnant, if you have kidney disease, liver disease, inflammatory bowel disease, diabetes, immune problems, or take regular medication, get medical guidance first. Now let's discuss topical zinc. You may see zinc PCA, zinc gluconate, zinc oxide, or zinc pyrithione in skin products. Zinc oxide is often used in sunscreens and barrier creams. It is soothing and protective, but it is not primarily an oil-reducing acne treatment. Zinc PCA is used in some products aimed at oily skin because it combines zinc with a humectant-related molecule and may help with sebum appearance and skin comfort. Zinc pyrithione has been used in dandruff and seborrheic dermatitis products, though regulations and product availability vary. If your oily skin is actually greasy scaling around the nose, eyebrows, scalp, or beard area, consider seborrheic dermatitis. That needs a different plan, often involving antifungal treatment. How should you use topical zinc products? Start simple. Use a gentle cleanser once or twice daily. Add 1 zinc-containing product if it suits your skin. Do not introduce 5 active ingredients at the same time. Why? Because if your face becomes irritated, you will not know what caused it. Patch test if you have sensitive skin. Stop if burning, swelling, blistering, or worsening rash develops. Now ask a deeper question. What is driving the oil? If oily skin appeared suddenly, look at changes. Did you start a new medication? Are you using anabolic steroids, testosterone therapy, certain hormonal treatments, or oily cosmetics? Did your stress, sleep, or menstrual pattern change? Do you have new acne along the jawline, increased facial hair, scalp hair thinning, weight changes, or irregular periods? These can point toward hormonal drivers such as PCOS. Zinc may support general skin health, but it will not replace proper evaluation for an endocrine condition. Pay attention to red flags. See a dermatologist or clinician if you have painful cysts, scarring, rapidly worsening acne, signs of infection, fever, spreading redness, severe tenderness, acne with irregular periods or excess hair growth, or skin symptoms that do not improve despite consistent basic care. Also seek care if your skin becomes oily with flushing, eye irritation, thickened skin around the nose, or persistent scaling, because rosacea or seborrheic dermatitis may be involved. Let's build a sensible routine around zinc. Start in the morning with a gentle cleanser. Do not scrub. If your skin tolerates it, use a lightweight, non-comedogenic moisturizer. Yes, oily skin can need moisturizer. Dehydrated, irritated skin can look shiny and feel tight at the same time. Then use sunscreen. Choose oil-free or gel-based formulas if heavier creams feel greasy. At night, cleanse again. If acne is present, consider evidence-based options like benzoyl peroxide, adapalene, salicylic acid, or azelaic acid, depending on your skin type and medical history. Zinc can sit beside these strategies, but it should not push them aside when acne is moderate or severe. If you are using prescription acne treatment, ask whether zinc fits your plan. With diet, add zinc-rich foods consistently. Do this before chasing high-dose pills. Put pumpkin seeds on yogurt or oatmeal. Add beans or lentils to meals. Include seafood, poultry, eggs, or dairy if they fit your diet. If you supplement, keep it modest, count all sources, and avoid long-term high dosing without supervision. How will you know if it helps? Track the right things. Take a photo in the same lighting once a week. Notice midday shine, number of inflamed pimples, tenderness, and how often you feel the need to blot oil. Pay attention to irritation too. Improvement should mean calmer skin, fewer inflamed bumps, and better comfort, not a stripped face that feels raw. The key message is this: zinc may be beneficial for oily, acne-prone skin because it can support inflammation control, immune balance, wound healing, microbial balance, and possibly sebum-related pathways. But it is not a cure, and it is not a standalone answer for everyone. Use it thoughtfully. Look at the whole picture. Hormones, skincare habits, diet, medications, stress, sleep, and skin diagnoses that can mimic simple oiliness. If you are dealing with oily skin, start with gentle care, review your diet, consider whether zinc intake is adequate, and get professional help when symptoms are persistent, painful, scarring, or linked with hormonal signs. Keep the plan steady for several weeks and do not harm your skin trying to dry it out overnight. Take care of your skin barrier, respect the science, and make safe decisions. I'll see you in the next topic.